Let me now introduce Jerry Rabelais, the chairman of the Department of Pediatrics and also the chief of service and at Kosair Children's.
Thank you, David, Jerry, Randy, all of you. It's a great pleasure to be the servant of the Department of Pediatrics and Service Chair for now in my 8th year. The service that this organization, that Kosair Charities, provides to the children of this community cannot be overstated. Certainly within the Department of Pediatrics, I'll give you some very specific examples that date back nearly 2 decades of their support for the Pediatric Infectious Disease Fellowship Program that trains individuals to become experts in pediatric infectious disease to prevent, to treat the scourges that we saw certainly 90 years ago in the form of polio, but even now in the form of severe influenza and other infectious disorders that still plague us. One of the graduates of that program was highlighted just a couple of years ago. She now works in a setting that provides a worldwide impact in developing the rotavirus vaccine that has prevented, literally will prevent a million deaths a year worldwide with that vaccine. And her training, her funding was due to these gentlemen's generosity. In addition to the nearly 20 years of supporting pediatric infectious disease training, this great organization has serviced a great need in terms of pharmacology and pharmacy development, because most medications are not developed with children in mind, and we use them as an afterthought, and dosing and other things have to be worked through. And when we went to the Kosair Charities well over a decade ago, maybe 12 years ago, to form something we now call the Kosair Charities Pediatric Research Unit, it's a network of pharmacology research units from around the country. It's very unique. It was one of only 13 when it was set up by the National Institutes of Health. And without funding and without support from Kosair Charities, it just would not have been possible. And it's now the main engine of clinical trials work and looking specifically at how drugs work in children. Because as we go forward, one of the very unique things we need to work through is the genetics of children and how they metabolize drugs. And this group, this set of investigators will be key. And were it not for that support, we wouldn't have that availability in the Department of Pediatrics at Kosair Children's Hospital and for this community. More recently, the Kosair Charities has supported a principal program that I want to feature today, and that's forensics. You all know the scourge of child abuse that this state suffers, where not very many years ago we were ranked #1 in the country in terms of child abuse deaths per capita. Around that time, we were very fortunate to recruit a young faculty member who was expert in this area and passionate like you wouldn't believe about taking care of these children, Dr. Melissa Curry. And the combination of her availability and our ability to go to the Kosair Charities and talk to them about this issue about 5 years ago, and for me to be able to tell Randy and the board, this is a big thing, and this is something we need to work on. Can you help us work on this? That has set up now one of just a handful of these programs around the country. We have the only 2 board-certified child abuse pediatricians in the state of Kentucky, both on the faculty and both in Melissa's division. We have the statewide responsibility now for caring for, evaluating, and testifying in literally dozens and dozens of trials and depositions throughout the year where these abuse issues come forward. The charities have been so generous. It has allowed us to expand this program, staff it with nurses and nurse practitioners, and even, most importantly, train the next generation of child abuse pediatricians. We've started a fellowship training program in pediatric forensics just 6 months ago, and our very first fellow is here along with Dr. Curry. Hopefully we'll convince her to stay 2.5 years from now, and she can be the next faculty member. And so this goes on, and you see how the contributions build on themselves, meeting the unique needs of each generation and of each time frame that we have. It was mentioned that we also have a program that's going to be starting here with general pediatrics and general dentistry. We know the Autism Center has been set up here on this campus, and so our affiliations and our interactions just grow and grow over time. My appreciation for them grows and grows over time. These gentlemen, in their humility, really see their work, really see their resources and the use of those resources as for community benefit, not for their own. It's a community asset that they provide that is so unique and makes Louisville one of the most livable places in this country. Thank you, Kosair Charities.
I'd like to introduce Terry Brooks, Executive Director of Youth Advocates. And if you would come, we had worked with Terry over the last year setting up the Kosair Charities Child Abuse Initiative, and he and his staff have done an unbelievable job. And I can't believe how fortunate we were to be able to connect with you, and thank you. So.
Well, it's 1923. Warren Harding is president. The Courier-Journal just carried a story because folks are complaining that gas has now reached 20 cents a gallon. A loaf of bread is 7 cents. The Yankees are getting ready to open their new stadium with a player they just got from the Red Sox whose name was Babe Ruth. Dr. Rabelais, the medical community has just introduced a new product called insulin. They say it could have impact. And you look ahead, and in the culinary world, there were two huge developments. One was Welch's decided that maybe you could buy jelly in a grocery rather than make it in your kitchen. And so for the first time, jars of jelly appeared in corner grocery stores. And hopefully you found, provided by KYA, a very nutritious breakfast on your chair when you sat down, because the first candy bar ever, a Milky Way, was introduced in 1923. I mean, that's the backdrop. And I wonder if folks in 1923, even the leaders of Kosair Charities, realized what they were birthing. You know, that great philosopher Charlie Brown says that a great potential is the heaviest burden to bear. And maybe the real compliment to Kosair Charities today is that they have borne that potential so very well. As you've heard today, Kosair Charities in those 9 decades have certainly taken care of kids in trouble medically. Dr. Ramsey alluded to something that I hear Jerry Ward talk about all the time, that, you know, in the 50s and 60s, this community was scared to death of polio. And Kosair Charities stood up and eradicated that plague. Well, I think that maybe the ultimate compliment to Randy, to Jerry, and to their colleagues at Kosair Charities is there's no rest here at Kosair Charities. There's no backing off from the great potential they bear. As Dr. Rabelais indicated, what I think is so exciting is that Kosair Charities has stood up and made a decision that they are going to tackle child abuse and neglect in this community with the same vigor that they eliminated polio. I mean, let's get this right. Dr. Ramsey could fill Patterson Baseball Stadium once, twice, 3 times with children who suffered abuse last year, and there still wouldn't be enough room to put all the victims in that stadium. And what Kosair Charity has said is that by the 100th birthday, there is not going to be a single kid in this community who ever experiences abuse or neglect. I mean, don't you love that? That they have taken a bold vision. Jerry, Randy, and their colleagues aren't saying that they're going to reduce abuse. They're not saying that they want to minimize it. They're not going to be satisfied until it's eliminated. So instead of resting on their laurels, they're moving ahead. And maybe I think that's the ultimate compliment to you two and your colleagues, is that you're willing to bear that burden with such vigor. So as we look back and as we look ahead, you know, I think the really exciting thing is that the track record of Kosair Charities tells us that in 2023, child abuse and neglect in Jefferson County is going to be just as real as a 20-cent gallon of gas. Thank you, Randy. Thank you, Jerry.
Thank you. Just a couple of housekeeping details. Our Dreams Take Flight Black Tie celebration will be August the 27th. 24th. I just checked to see if you were awake. And as Dr. Ramsey alluded to, the picnic, we are going to bring the Kosair Charities picnic back to the campus, and tentatively September 13th to 14th. And we'll let everybody know about that as soon as possible. And in celebration of the 90th anniversary, Kosair Charities would like to announce a $1 million commitment to launch a new matching grant program. The goal of the Take Flight matching grants is to inspire others in the community to partner with Kosair Charities by making grants of $10,000 or larger to Kosair Charities, and will have the opportunity to have that matched dollar per dollar. Donors will advise Kosair Charities on their intended purpose, consistent with the Kosair Charities mission, for which the dollars, along with Take Flight matching grant, will be designated. Any questions about that, contact Teresa Rady, who's our Chief Missions Advancement Officer here at the campus. We've talked about 90 years, and it is overwhelming, but this is a time to look forward and a time to reaffirm our mission to protect the children and the well-being of children, the health and well-being of children, and time to celebrate the hundreds of thousands of children that have passed through Kosair Charities' hands and have another chance at life. So on behalf of the 2,500 Kosair Shriners and our thousands of supporters, thank you for joining us today and making this part, reaching this celebration. Thank you all. I'm gonna let you do the cake thing.